It's a pleasure for me to be here. As mentioned, I'm the director of the National Institute of Mental Health, and we have been coordinating a lot of research activities of relevance to the COVID pandemic, and that's what I'm here to talk about today. Happy to take questions and provide answers to the best of my ability. Let me just, by way of introduction, say that there's going to be a number of aspects of the pandemic that will most likely increase the demand for mental health services, and that's one thing that we know from past disasters and epidemics. The other thing that we know from past disasters and epidemics is that the WHO will suffer, and it is a result of a combination of many risk factors. And unfortunately, with regard to the pandemic, those risk factors are sort of combining for many of us. So these include those at risk include those who are directly exposed to loss of life or injury. In this case, we're talking about frontline healthcare workers. We're talking about people who watch their loved ones become ill and unfortunately succumb to the coronavirus. If we're talking about the other impacts, though, that increase risk of mental health consequences of the pandemic, other risk factors include economic disruption, which of course most of us are experiencing. And then protective factors include strong social support networks, which are tested by the COVID pandemic because of the need to physically isolate from others. So we put those three things together and we can anticipate an increased need. How big an increase, we really don't know. And to what extent that increase will lead to increases in the worst consequences of mental illness, such as death by suicide or drug overdose, that's somewhat unclear based upon past data, but we want to be prepared for it. We want to make sure that we understand the full nature of the mental health consequences of the pandemic and that we gear up to meet the anticipated increases in need for mental health. We are engaged in lots of research activities to respond to that and to ensure that we do our part in meeting the challenges from the COVID pandemic. One aspect of that research is to understand the full extent of the pandemic, in essence, to build upon our prior understandings of the effects of epidemics and disasters, but to, in particular, study the unique aspects of the pandemic. One unique aspect being, of course, that nearly all of us, if not all of us, are affected by the pandemic directly and indirectly. The second unique aspect is the fact that it's geographically universal, as opposed to, like most disasters, located in a particular place. And the third aspect, of course, in comparison to disasters like hurricanes or earthquakes, is that it's somewhat long-lasting, right? That we've all been affected by the pandemic now for a couple of months, and we can anticipate those impacts continuing into the future, whether or not an individual's community starts opening. The pandemic consequences are going to continue. So we need to be aware of all these factors, and we need to understand their unique impacts on mental health. But even more importantly, from the perspective of the National Institute of Mental Health, we need to ensure we conduct research that will allow us to understand how best to implement effective countermeasures from a mental health perspective in the communities that are most affected. And that includes first responders, that includes other essential workers, healthcare or others, including grocery clerks and delivery personnel and transit workers, but also underserved areas where the impacts are felt more from the pandemic, where individuals were already at a challenge in terms of getting healthcare, in particular mental health care. So we need to understand how to implement effective therapies that we know to be effective from various prior studies. We need to understand how to implement those across the nation, and in particular in these underserved areas. So those are the two main thrusts of our research: understanding unique aspects of the pandemic and engaging in research that allows us to learn how to implement effective therapies in the context of the pandemic. So with that introduction, I'm happy to turn it over and take questions.
Thank you so much, Dr. Gordon. I'm going to turn to Terry Schwartzbeck in a moment to ask questions, to share questions that have come in through chats. But I actually have one. I'm going to take the privilege. I'm just thinking about the possibilities of PTSD for the healthcare workforce, and also the difference in grieving that may occur for folks whose parents were in nursing homes or assisted living, and they couldn't actually have physical contact, or they couldn't go to the hospital to be with their loved ones, in the last moments. Is there research ongoing, or do you anticipate research to kind of look at these factors, and going forward, how do you intervene more quickly, or is it even possible? Is that a line of research that you anticipate, or that may be already underway?
I think those are great questions, and to some extent, we have answers from previous epidemics and disasters in terms of the effect of the mental health effects on people who have lost loved ones. That's obviously a substantial risk factor. We also know, of course, that the grieving process can be prolonged in individuals who have challenges assessing the typical support mechanisms, and that usually includes things like funerals and wakes or shivas or other recognition of the loss, and also that the support and the closeness of support from loved ones helps people recover more quickly and go through the grieving process with the minimal long-lasting mental health disruption. So I would say we can anticipate that the challenges posed by the pandemic, not being able to be there with loved ones, is going to be something to watch out for, and something we need to respond to. That said, there are areas of research where I think we are interested in trying to understand, particular with regard to individuals who've been in the hospital and have survived COVID, but went through a period of weeks at times weeks of hospitalization and frightening weeks, sometimes including ICU stays and intubations, where they were not able to be as actively comforted by their loved ones as typical. And that's one thing that we want to understand: what's the long-term impacts on those individuals. And yes, understanding what helped and what worsened the grieving process for those who are unable to attend a funeral, unable to have the usual social supports in place to comfort them through the grieving process. That's also something that we want to continue to try to answer.
I think it's fascinating, because I think that NIMH in a lot of ways is a first responder, but COVID itself has lessons even for something like OCD. You can imagine that some of how folks are coping in this environment may be really useful going forward in the treatment of OCD. It's a tragic way to get to better knowledge, but before I turn to Terry, there's one other thing I'd like to say in terms of first responder, is that one of the things I really admire about what you're doing is that you provided opportunities right away for folks to be involved in clinical research, to try to understand, as it was going on, what the effects are. I know that because I'm participating in one of your clinical studies, and I just was I was so impressed that right away you were on the ground and trying to figure out what the effects were of this. So I just wanted to thank you for that. And let me turn to Terry to see if we have any questions through the chat, and then we can open the lines.
Sure thing. And just a reminder to our audience that you can click on the little bar that says questions, and it will open up a window where you can type in questions that we can see. One question that has come in for you, Dr. Gordon, can you speak a bit about the importance of clinical trials in mental health research? And is there more or less difficulty in attracting volunteers given the pandemic? Has anything had to close down, or are more coming online?
That's a great question. I really appreciate it. Unfortunately, the pandemic has affected clinical trials that NIMH supports and that we directly conduct in the intramural program in substantial ways, just like it has affected clinical trials really across the board for biomedical research. Most universities have shut down their research except for research that is deemed mission critical or directly responsive to the COVID pandemic. And that means that many of NIMH's clinical trials have been suspended, or if they haven't been suspended fully, they have moved to online and telehealth evaluations. And this is a tremendous disruption to our research. We anticipate that disruption that will start to ease as communities open up and as universities begin to allow their researchers back into the labs and the clinics. But we also recognize that there will be a need for resources to help restart those research programs, clinical and otherwise, as well as a recognition that we need to do something for those research projects that have been delayed, whether that means giving them additional support so that they can increase the rate of recruitment, for example, for a clinical trial, or increase the amount of time that those clinical trials are permitted to enroll and time for the data analysis and reporting, et cetera. We recognize that clinical trials, as well as other research programs, have dramatically been disrupted. I'm glad to hear you're participating in a clinical trial that is ongoing. We have a number of survey-based and remote assessments that the intramural programs rolled out. A lot of our trials and particularly longitudinal studies have been engaged in research trying to measure the impact of the pandemic on their existing cohorts, and we think of those cohorts as tremendous resources, not just for their original purposes, but also to understand the mental health and other consequences of the pandemic. So we're really pleased to be able to roll out support rapidly in the form of the intramural research program. And on the extramural side, we have calls for supplements, and we're reviewing those supplements now, and we hope to be able to get them out really within a matter of weeks. We recognize that this is a unique opportunity and a unique challenge for our research, and we want to make sure to meet the challenge and take the most of the opportunity.
That's just terrific.
Great.
I, of course, have a million questions. Terry, do you have other questions?
Yeah, loads of questions coming in. So thank you, everyone. We'll try to get to as many as we can. Another question that's come in, we know that NIMH has had a new strategic plan that was being finalized as the pandemic really developed. Can you tell us if anything from the pandemic has influenced your strategic plan or any other strategic planning implications?
Yeah, I can talk to you about that. So first and foremost, I want to say a huge thank you to my staff. The NIMH extramural staff is, well, all of us, but particularly extramural staff, is working really two jobs right now. They're trying to maintain the typical usual activities of the National Institute of Mental Health, evaluating and funding grants, across the country to address the many issues in neuroscience and in mental health and in psychology and more that we fund across the board. But in addition to that, we are, as I just mentioned, trying to ensure that we conduct the research necessary to understand and mitigate the effects of the pandemic. Add for a select group of our employees a third job, which is to put out the strategic plan. And it is amazing that strategic plan came in on time, and really it's a wonderful product. The biggest thing that's different about this plan is that it's a living document. It is on the web. It references the latest research in terms of progress reports and press releases, and it's changeable as we go and revise our priorities. It's changeable, it's flexible, so that we can make sure that it's current and up to date. So I'm really pleased with the strategic plan, and pleased, as I said, with the tremendous effort of all the NIMH employees who worked really, really hard to get it out on time. Was the subject matter affected by COVID? Not really. It's been in the plans for 2 years. And the final draft of it was only released a week or two ago, but the drafts were coming over a period of months. However, I don't think you would. I don't think you would find that it's completely irrelevant to the issues raised by the COVID pandemic. We have in the plan strategies for science based on understanding the impact of digital health measures, of telehealth measures for mental health, of studying large data sets to examine multimodal factors that result in risk and resilience for disorders, in emphasizing the importance of longitudinal studies, which are going to be very, very useful to study the impacts of the pandemic. So I think throughout the strategic plan, you can find items that are directly relevant to the pandemic, even if they weren't responsive to it.
Wonderful. Thank you so much. And let's see, I just saw a question specifically, could you build a little bit more on that telehealth? Is there specific funding in the context of COVID-19 to support clinical or health services research on the treatment effect of telehealth? And are there researchers to help practitioners better navigate reimbursement for telehealth moving forward?
I'm not aware of the reimbursement piece. That's an interesting one. I'll have to think about. I appreciate that input. The other part, though, yes, definitely. We put out an announcement for a notice for supplements, or a call for supplemental research to existing grants to study digital and telehealth interventions as one aspect of the intervention approach to the responding to the pandemic. So that's definitely out there, and we're working on more. We're working with some of the other institutes so that we can collaborate on these approaches that are meant to understand risk, resilience, and interventions to mitigate the pandemic, particularly with an eye, as I mentioned before, to these vulnerable and underserved populations. So I would anticipate more, but yes, we already have a call out that focuses on these digital interventions.
Great. And another question, can you speak a little bit perhaps about how you are working with the private sector during the pandemic and or with patient groups?
It's a great question, private sector and patient groups. So first and foremost, both of those are represented in the NIH-wide response to the pandemic, particularly with regard to the collaboration that Francis Collins leads with drug companies and others to test interventions that directly are meant to directly attack the virus, and that's been tremendous with really a number of wonderful collaborations between NIH, academia, and private groups, and both advocacy and pharmaceutical industry. And already there are a number of trials that are getting off the ground from that effort. We have focused in 2020 at NIMH on trying to supplement what we're already doing, because that's the fastest way for us to get new projects out, is to give supplements. We can do that in a matter of weeks as opposed to months or even a year that it takes to normally get out a grant. So it's early days in that regard, and we have not yet gone to public-private partnerships with those particular efforts. But we are rolling out other community-based efforts where we're really going to need to reach out to community-based organizations. And we are engaged in, as I said, these digital health and other interventions where private partnerships will really help a lot. So I would look forward to that coming over the next few weeks and months.
Great, thank you so much. Another question, any thoughts about the effects of school closures on youth mental health?
Well, I think we can all appreciate that school closures are going to have substantial effects on youth mental health. But let me first preface it by saying that kids are really resilient. And in the context of previous disasters, although there have been increases acutely in mental health complaints, and there are certainly long-lasting consequences for some children, the vast majority of children, just like the vast majority of adults, do recover within a matter of weeks to months after a disaster. Now, that, again, there are unique aspects of this pandemic that we can't really predict, but that's one positive possibility going into the pandemic. However, schools are important sources of of resilience building, and also for many children of actual treatment for mental illnesses. So there are kids out there who are not getting the treatment that they need because the treatment providers are located in the schools, or maybe they're still getting that treatment, but they're getting it in a less effective way or less frequently. So we have to recognize that children with pre-existing mental health conditions are going to be affected by the school closures. There are also myriad other effects besides the school closures that are, of course, affecting the mental health of our kids. And that includes the fact that they are just like the rest of us, or have been until very recently, isolating themselves in the home. They're not seeing their friends except for virtually. They're not engaging in the same sorts of social activities, not engaging in the same sort of athletic activities and other communal activities. These are going to have substantial effects on kids. And that's of great interest not only to NIMH, but to other institutes as well. But again, I'll close with the same thing that I opened with. The evidence from prior disruptions is that most kids will, over time, recover. And so it's our focus from a research perspective at this point is understanding those factors that facilitate recovery and those factors that put kids at risk of not recovering.
Great, thank you so much. And I've got a couple of questions as well about comorbidities. Anything you want to add about how you'll be looking at comorbidities with chronic diseases and mental illnesses? Any particular challenges that you're seeing emerging so far?
Yeah, so we just put out a notice of special interest, which is sort of presaging, notice of special, a notice of intent to publish, which presages a number of different announcements for funding that we are conducting along with several other institutes. And the plan with those institutes is to study the effects of the COVID pandemic across a broad range of outcomes in a broad range of vulnerable groups. And those vulnerable groups include individuals with serious mental illness. They include individuals with pre-existing mental and other health conditions. We are encouraging our investigators to take a data-driven approach to answering these questions, utilizing existing databases, both clinical and administrative, that follow individuals over time from before, during, and hopefully after the epidemic as well, to be able to look across these different populations of risk, including those with comorbid mental and other health conditions, to understand the role of comorbidity and whether individuals with those comorbidities are at greater risk with the pandemic. Let me add that an important comorbidity, of course, is substance use, and we're working with NIDA and NIAAA, that is the National Institute of Drug Abuse and Alcoholism and Alcohol Abuse, and to try to ensure that those groups of comorbidities are captured as well through this data-driven approach.
Wow, this is Ellie again. That's fascinating. Dr. Gordon, is there any evidence that you know of in terms of serious mental illness, in terms of vaccination rates, disparities in vaccination rates for that population?
You know, that's a great question. I do not know the answer to. I know the answer to many health disparity issues with regard to serious mental illness, but I don't know about SMI. You know, serious mental illness is most typically thought of as an adult issue. When we think of serious mental illnesses in childhood, we think of autism and we think of other childhood onset disorders like ADHD, etc., and less about schizophrenia, less about bipolar disorder, because of course they're happening earlier. But those early onset disorders are happening typically after the bulk of vaccinations are occurring. But one big question that we have moving forward that is really important to address is what about testing for the virus now and in the future when vaccinations are available? Vaccinations, how do we make sure that individuals with SMI are are vaccinated, are getting tested when they're appropriate, are engaging the healthcare system when they need to. And there certainly are disparities in access to healthcare amongst individuals with SMI that lead us to be concerned about these issues. A related issue is, of course, access to these same healthcare opportunities with regard to testing and vaccination amongst the homeless. Of course, many
Yes.
of the homeless are have serious mental illnesses, and homeless and SMI, those are two independent but interrelated forms of health disparity. And we've already seen that there is, in some jurisdictions, a reluctance to go testing the homeless because of the incumbent responsibilities to ensure that they remain isolated, et cetera. So we need to address those issues together. And that's definitively part of this effort that I described, where we're trying to study the risks, resilience factors, and interventions in vulnerable populations. Homelessness, SMI are definitively in those vulnerable populations.
I think it's terrific. Thinking about, and speaking of comorbidities, flu, pneumococcal pneumonia, when you're in hospital, the risk for that increases. So, those adult vaccines too, it's just an interesting, I know that there are racial and ethnic disparities, but I don't know about mental health disparities.
There are definitive health disparities pretty much across the board with regard to those with serious mental illness. And while we're on that subject, not so much with vaccinations per se, but that's true in individuals with autism. Kids and adults with autism are less likely to be diagnosed with other health conditions. They're less likely to get appropriate levels of care compared to individuals without autism. So really across the board with SMI, there are health disparities and the reasons for those are complex, right? So of course, individuals with SMI are perhaps less trusting, less likely to seek health care, but there's also some evidence that they're less likely to get appropriate health care when they do seek it. So.
Wow. Well, you've been very generous with your time, Dr. Gordon. I thought I could ask you about 10 million questions, but I'm going to refrain and just thank you so much. I know how busy you certainly are. So it was really wonderful that you could, be generous with your time with us this afternoon. So appreciate it.
Well, it's really my pleasure. It's my pleasure to be here, and I'm glad to speak to the Research America. You all are incredibly important in ensuring support for research across the board, and to NIMH specifically. I always enjoy working with you all. Thank you.
Thank you. And to our members on the call, thank you for being an Alliance member. As always, we so value your partnership. Hope that to be in touch with us on any and everything. We'll try to help if we can. And I did want to mention that Dr. Kelvin Drogemeyer, the director of OSTP, Office of Science Technology Policy, will be joining us on June 11th. We'll be sending out an invitation to you soon. We're trying to be wary of not bombarding you with emails, even though you may feel like we are. We're trying to be parsimonious. And thank you again, and stay in touch with us.